Community mental health really focuses on the chronically and the seriously mentally ill. We provide very good services for that community of individuals that are dealing with serious mental illness. We offer a really good team of psychiatrists that works with those individuals. We have nurse practitioners that work with those individuals, and we try to provide them with the best medical care that's out there in terms of what's available for the seriously mentally ill. But that's a real small piece of it. It's an integral piece of it. But what we really focus in is, what does an individual need to live in the community as successfully as any of us? Well, they need a good place to live. They need a safe place to live. They need a job. They need a social fabric around them. They need what we all need, contact and communication and safety. So we have 4 case management teams that actually work with the seriously chronically mentally ill, different subsections of the population depending on the funding. One team that works with folks that have overlap with the criminal justice system, one team that works with people over 60, one team that works primarily with the homeless, and then the team that I supervise that works primarily with the community at large. But we're all providing the same kind of level of care, helping people live in the community, helping them get to their appointments. If they get hospitalized, supporting them through the hospitalizations and helping them come back to the community, helping them get jobs, helping get supported jobs, because some of them have not had an opportunity to be in work settings for extended period of times, and they don't know what that's about. So they need support as they enter the job market again, developing particular jobs for many of our clients. So we want to provide as whatever we can to help those individuals live in the community and live as successfully as we can. Enterprise Resource Center has a peer-run drop-in center that's right on this campus. People can come, there's groups, there's support, there's computers, there's outings. It's to create a social fabric for many of these folks that, again, are fairly isolated and on their own. What we value and we know what's important for folks is making relationships. So we want to make relationships with these clients. We want the clients to see us as a resource and to trust us so that we can work together to see what they would like to achieve. We work a lot with families. We have family members and peers in our teams. People have experienced mental illness themselves. So we try to really integrate the services for the benefit of the individual that's out in the community and trying to help them.
In my work with community mental health, youth and family services, we provide screenings and assessments of children or youth that are referred by the family, by probation, social services, the school system, to get a sense of if what they are exhibiting or saying could warrant a mental health intervention. And those we offer on a continuum of care from outpatient all the way to residential care. And of course, if it's urgent or emergency, through our psychiatric emergency services unit, anyone from any age can just show up 24/7. What I'm doing with the nonprofit Interactive Parenting Media that I also serve is trying to use mass media, community events, printed, online, television, radio, to try to supplement those face-to-face supports and to disseminate information that anyone could benefit from about those signs and symptoms, about what helps and what doesn't help, about factors for resilience as well as risks, so that people are not that isolated and so that the topic is not taboo and we can say it if we feel it.
We currently facilitate team meetings for the county. Families that are involved with either Child Protective Services, that's now called Children and Family Services, juvenile probation, and community mental health. Those 3 agencies have the responsibility of also placing children. And so our focus are on children that are at risk of out-of-home placement within those 3 agencies. When a family is at risk of out-of-home placement or a minor, we bring together the family members, the professionals, and facilitate a meeting. The meetings that we call is our family network. It's a trademark process where we gather the individuals to address what we call the risk factors. What brought this family or this minor into the system or to the attention of this agency? And our primary purpose is to identify, address, and resolve those risk factors by using the strengths that the family already has or has used in the past to deal with them. And if they haven't had certain coping strategies, it's to help that team, help that family to implement them to reduce and resolve those risk factors. And that's what we primarily do. So we facilitate meetings. We no longer actually provide the direct service, but our expertise is actually facilitating that process that brings those various entities together and allows them the ability to talk and then synthesize that information in such a way to where we develop a service plan with them that we then give out or send out to the various participants.
We have a counseling program for people of all ages, and we also offer a good deal of consultation and support for parents and for caregivers, because our perspective is that we absolutely want to support the LGBTQ youth themselves, particularly around mental health, but our belief is that if we change the systems around them, their mental health will improve. And so we're doing sort of an inside-outside job with LGBT youth in creating safer spaces for them. So we have counseling program, we have a monthly support group for LGBTQ youth who are 14 to 19. We have a resource library, lots of different things that people can read to better understand themselves and others. We also have a speakers bureau, and this is volunteer speakers from Marin County who are lesbian, gay, bisexual, or transgender. And we just put a face to something that still makes people uncomfortable. We go to classrooms and community organizations and we just share our stories. And people have an opportunity to ask us questions in a safe space. And we find that that really helps the mental health of LGBTQ youth because they feel seen and heard and understood in their schools.
Buckelew is a nonprofit in Marin, Sonoma, and Napa, and they work with people with a mental illness. And they are experts in the housing field. They house, case manage. They do a lot of different types of housing, so it's geared toward different needs of people, which is really great. It's not just a one-shoe-fits-all. They also offer a employment training and employment program that's terrific. A lot of our youth have been in that program and learned skills. It's a wonderful program. And then they offer the TAY program, which is geared toward the transition age youth, helping them become independent. We specialize in youth with a mental illness, so also recent diagnosis. So, ages 16 to 25 is often when they're recently diagnosed with a severe mental illness like schizophrenia or bipolar. And we work very closely with the family and with the youth to understand what they're going through, to try and meet them right where they are in the moment, and then to build with them in a collaborative process what they want for their future and to try and help them with that. Support them in all ways that they need, psychiatric, education, employment, housing, social. We do quite a bit, yeah. We have art, music. We really try and understand what they need and what they're interested in, collaborate with them so that we can get their feedback on what they want to do and what would be engaging for them. So we try and provide an environment that's engaging and meets their needs.
Huckleberry's been around over 40 years. All of our programs since then have really been designed to support teens and their families in one way or another and help them become productive adults. So in Marin, currently our two programs are located in Central San Rafael, right across from the high school. One is a health program, so it's really designed to promote teen health. We have somewhat of a focus on teen pregnancy prevention. So we have two drop-in teen clinics that we operate for youth in collaboration with Marin Community Clinics. One's in Novato and one's here at Montecito in Central San Rafael. Teens can drop in for care. It's focused on sexual and reproductive health, but many youth access our mental health services in that way. Many youth access our substance abuse counseling in that way, as well as our support groups. So it's free, confidential. Teens just need to show up in the afternoon. We go into the schools and we provide hundreds of workshops on teen health issues, many of them geared towards healthy relationships, decision-making, STD prevention of sexually transmitted diseases, teen pregnancy prevention. We also have counselors on staff that really enjoy working with teens and their families. Our other program is called the Huckleberry Wellness Academy, and it's a relatively new program. We're very excited about it. And it's focused on young people who are the first in their family to go to college. These are young people that have an interest in the health careers, so we engage them as 8th and 9th graders, and we really support them all the way through high school to enter college. We do that through group support. They all participate in health internships. They have health speakers come in. We provide academic counseling, tutoring, parent education. It's a very intensive wraparound program to nurture their academic success first and then their entry into the health professions.
Novato Youth Center has been in the community for 35 years. We have a variety of programs in 5 target areas. Youth and family counseling, which I'm part of, is one of them. We also have child development, which encompasses early childhood and after-school programs. We also are part of the Novato Youth Wellness Collaborative, which has many organizations. We're one of them. We also have health education and family enrichment programs. And our last one is sports leagues. In terms of youth and family counseling, we have been partners with the Novato Union School District since the early 80s. In the past year, both in our services that we provide in our clinic, in our main clinic, and also at the Novato Wellness Center, and in the schools, we see 700 clients, so youth and families that are receiving counseling services.